Mental Illnesses and a Useful Treatment. A PSA by William Edwards. Mental illness is a horrible reality for many people around the globe. It affects everyone throughout the world. Suffering from mental illnesses is a huge part of many people's daily lives. However, for many other people, experiencing mental health issues is something lots of people deal with in their relationships with their friends and family. Surveys and studies have shown that 25% of adults and 40% of children will show signs of mental illness throughout their lives. What isn't accounted for in this is the people that have social relationships with those affected by mental illnesses. While the affected must deal with a lesser quality of life, suffering from their symptoms, those unaffected by mental illness still deal with the symptoms in a different way. Relationships are built on interactions between two people, but when one of those people suffers from a mental illness, their behavior towards the other can be affected in a way that is not easily controllable without aid. This behavior can cause the relationships of an individual to weaken as people don't enjoy being mistreated by those that they are close with. Common mental illnesses include depression, anxiety, ADHD, bipolar disorder, and post-traumatic stress disorder. These commonly affect a person's brain chemistry and their behavior towards others. These are often caused by factors such as genetics, past physical trauma, severe life events, or bereavement, which is the death of someone close to them. Mental health issues can present themselves in different ways. While there is a fairly common list of symptoms, no case of mental illness is the same, and each symptom can be exhibited differently. Alongside this, people can attempt to mask their symptoms as they don't want others to know about their mental illnesses. There are many different types of therapies that are used in the treatment of mental illnesses. More common therapies include cognitive therapy, exposure therapy, and group therapy. The main intent of these being to help individuals discuss and understand their feelings, working to get past the symptoms of their mental illnesses in an attempt to live a more normal life despite their mental health. Another form of therapy is music therapy, which studies have shown to be greatly effective in treating those with mental illnesses. It is used to both calm people down and to express emotions when talking and writing are not an easy-to-use emotional outlet. However, despite its usefulness, music therapy is an extremely uncommonly used practice. Whether it's medication or the aforementioned therapies, comparatively, music therapy is not used as treatment as often as it should be. Unfortunately, many people are missing out on the benefits of music therapy without even being able to try it. Music therapy is known to only be used for 1 to 2% of people treated for mental illnesses. While therapy should only be used if it works, the amount of people from the statistic are not those being introduced to the therapy. There exist 4 different types of music therapy. The first is improvisational music therapy, in which a person uses instruments and makes up melodies to play and express their feelings. The next type is compositional music therapy, in which a person writes and arranges a piece of music to express their feelings. The third type is receptive music therapy, which has a person listen to pre-made music to calm their emotions, allowing for clarity for their feelings. And the last type is recreative music therapy, in which a person or people will read music or recreate music shown to them to calm down and express their emotions. Music therapy is of excellent benefit to those who suffer from mental illnesses, and the underuse of it in treatment is unfair to many people that would benefit from this type of therapy. Learn more in the description below about ways you can get involved with promoting music therapy and supporting associations that promote music therapy throughout the world.